morning. I'm Dr. Madhavram Balakrishnan. I work in the pharmacovigilance team in the WHO headquarters in Geneva. Today, we are going to be discussing about monitoring adverse events following COVID vaccination. At the end of this training, you should be able to identify an adverse event following immunization, describe how to respond to an adverse event following immunization, and also explain how to report an adverse event following COVID-19 vaccination. So let us first understand what is an adverse event following immunization. It is actually an untoward medical occurrence which follows immunization and does not necessarily have a causal relationship with the vaccine usage. The adverse event can manifest as an unfavorable symptom, for example, itching or occurrence of a rash, which the patient complains about, or it could be an abnormal laboratory finding, for example, thrombocytopenia, or it could be a symptom which is found out when a physician examines the patient, for example, enlarged lymph nodes or an enlarged liver, or sometimes it could be a disease, for example, meningitis, which are all detected by a medical practitioner. So what can be the cause of an adverse event? An adverse event can occur because it could be a vaccine product related reaction, which means the contents of the vaccine itself was responsible for the adverse event, or it could be due to a quality defect related reaction where during the time of manufacture, there could be a problem with its manufacturing process or by the device which is supplied by the manufacturer, resulting in the adverse event. It could also be due to an immunization error, which could be caused by inappropriate vaccine handling, prescribing, or administration. It could also be due to an immunization anxiety related reaction, which could be because of the fear of injections, or it could also be a coincidental event which happens after vaccination, but it is not because of either the vaccine or the vaccination process itself. Now let us look at each of these in detail. First of all, let us look at vaccine reactions. What is this vaccine reaction? Vaccine reaction is an individual response to the inherent properties of the vaccine, even when the vaccine has been prepared, handled, or administered correctly. It can be because it is a vaccine product related reaction or a quality defect related reaction. By intensity, vaccine reactions can be classified into minor reactions. For example, pain at injection site, minor swelling at the site of injections, fever. It could also be because of a severe reaction. A severe reaction actually represents the intensity of the reaction, where it can be either a serious reaction or a non-serious reaction. We are soon going to be learning about what a serious and a non-serious reaction is. So what is an immunization error-related reaction? This is caused by inappropriate vaccine handling or administration. It may occur due to a human error, such as a reconstitution error, where there is the use of an incorrect diluent or a diluent mistakenly substituted with a drug vial. This occurs particularly when vaccines and drugs are stored together in the same place. The next one is a contamination of the vaccine or sometimes a contamination of a syringe. This can occur when there is a touching of the needle or the rubber cap of the vial with a hand or any other object. Or it could even occur because of the use of a reconstituted vaccine after 6 hours of its reconstitution. Sometimes it can occur because of an administration error, that is an incorrect vaccination technique. For instance, if the manufacturer prescribes that the vaccine should be administered subcutaneously and the vaccine is given intramuscularly or intradermally, for instance. These immunization errors can cause severe reactions and can lead to serious AEFI and can sometimes result in death. And remember, these are all preventable provided we take care at the time of vaccination. Now, let us see what is an immunization anxiety related reaction. It is caused because of the fear of immunization and also the fear of injection. And different factors can contribute to anxiety related reactions, such as the vaccination environment, the fact that the vaccine itself is very new, and many people have the fear of injections. It's important to remember that to prevent fainting and injuries that could occur because of a fall, vaccinated individuals should remain seated for 15 minutes after vaccination. Now, let us look at the coincidental events which can happen after vaccination, but which is not caused either by the vaccine or the vaccination process. Remember, when we are vaccinating people with for COVID vaccines, a huge chunk of the people are actually adults and elderly populations. And many of them will have chronic diseases which can develop irrespective of vaccination, but many of them will blame the vaccine for that. We should also remember that similar events can occur in healthy individuals where higher frequency of a specific condition, including communicable diseases which are ongoing in that area, can occur based on the age, sex, geographic location, or ethnic background. Now let's look at other important terms and definitions. Let us first look at what is the difference between a serious AEFI and a non-serious AEFI. A serious AEFI is one which results in death, is life-threatening, requires hospitalization or prolongation of existing hospitalization, results in persistent or significant disability, or is a congenital anomaly or a birth defect. Whereas a non-serious AEFI does not pose a potential risk of the health of the recipient. But remember, both serious and non-serious events should be carefully monitored. Now let's look at a cluster. A cluster is actually the occurrence of two or more adverse events of the same type or which are similar, which are related in time, place, or the vaccine which is administered. You should also remember that coincidental events can also occur as clusters, and it is actually very common to see immunization stress related responses which can occur as clusters. Always remember that clusters should be reported and each and every individual case should be reported. So, how can we prevent immunization error related adverse events? Immunization error related adverse events can be prevented by not storing or packing the vaccine with the other drugs and medications. It's important to always check the labels of the vaccines and diluents before reconstitutions. And most importantly, remember the vaccine and the diluent should be from the same manufacturer. During reconstitution and vaccination, it is very, very important to follow the manufacturer's recommendations on storage, vaccine preparation, route and technique of administration, and contraindications and precautions. Draw the auto disable syringe just before vaccination and do not touch the needle. Also remember that you should not touch the rubber cap of the vaccine vial. If reconstituted, never carry vaccines from one place to the other. Do not cover the vaccine carrier with the lid while the reconstituted vial is in the foam pad. Discard the vaccine if it is reconstituted before the maximum recommended time or at the end of the session, whichever comes first. And most importantly, whenever you're in doubt, do contact your supervisor for clarification and do not hesitate to report issues or concerns when identified. The AEFI monitoring cycle, the key players and the roles. AEFI monitoring actually starts right at the time of vaccine administration. At the time of vaccine administration, it is important for healthcare workers to provide information to the beneficiary as to what to expect after immunization and what to do after immunization. So, at the time of vaccination, it is important for the healthcare worker to give a briefing to the beneficiary and tell them that what kind of adverse events to expect and what to do if these adverse events occur. Now, if these adverse events occur, they need to be detected first, which can take place by the patient or it can take place by the health worker. And once it is detected, it has to be brought to the notice of the health system. And this can be done again by the patient or by the health worker. And this is actually what is called the notification. All notified cases need to be reported. Now, what do we mean by the word reporting? By the word reporting, we mean that an AEFI reporting form, which will be described in a couple of minutes, will be completed by the first respondent. So when an AEFI reporting form is completed, it is actually sent to the next level of hierarchy in the immunization program, where a decision is made whether this is a serious event which needs an investigation or not a serious event which can be managed locally. If it is a serious event which needs investigation, an investigation team is constituted and a detailed investigation is instituted. So the data which is collected from the AEFI reporting form is put together and it is actually analyzed. This is helping us to find an idea whether there is a pattern in the occurrence of the adverse event following immunization. Now, the AEFI cases which are investigated need to be assessed for causality. In other words, we would like to know what actually caused this adverse event. And this is actually what is done by a special committee, which is called the AEFI committee, which helps us to finally classify this particular case. The findings of this particular classification is provided to as a feedback to all the people in the hierarchy who identified, notified, reported, investigated this particular case. So now let's see what AEFI should be reported and how should these reports take place. It's important to report all AEFI that is brought to the notice of the healthcare system. The first thing to do is to complete the AEFI reporting form as accurately as possible and send them to the supervisor. It is important to use the COVID-19 AEFI reporting form and make sure that the contents are as accurate as possible. It is also important to remember that you should report non-serious AEFI according to the country's policy. In case of serious AEFI, inform your supervisor and the AEFI focal person immediately and make sure that the report is transmitted to them within the next 24 hours. Let's look at the AEFI reporting form. It's important to remember that there are some changes from the standard WHO AEFI reporting form, and this is made in the red font, as you can see on the screen. This includes specifying the COVID vaccine brand name, the name of the manufacturer, the age of the recipient, and whether the recipient is currently pregnant or lactating. All AEFI, whether it is minor or severe, should be reported in this form if the case has been notified. The reporting form should be completed and the case should be line listed. So what should you be aware for the quality of reporting of the AEFI case? Remember, when you complete the COVID-19 AEFI reporting form, it is important to ensure that the information on the brand of the vaccine, the name of the manufacturer, the dose number, the diluents used, the batch numbers, and expiry date must be accurate. The details pertaining to the identifier, that is the reporter, The address of the vaccine recipient, such as the contact details, as well as the reporter's own details, should be correct. When entering data on the event and the clinical features, include all information to the best of your knowledge. So, what are the AEFIs to be anticipated after COVID-19 vaccine based on clinical trials? They are known minor AEFI from COVID-19 vaccines are similar to other injectable vaccines and include injection site pain, headache, fatigue, and muscle pain. Other minor AEFI include fever, chills, nausea, and arthralgia or pain in the joints. No serious safety concerns have been reported to date. As a general precaution for any vaccine is to anticipate allergic reactions, including anaphylaxis to any of the vaccine's component. So, what are the extremely rare safety events that a health worker should be prepared for? One of the very rare but important safety events to be prepared for is anaphylaxis. This occurs at an estimated rate of less than 1 per million doses, but remember, it can be severe and sometimes potentially fatal. Proper diagnosis and urgent treatment and management are essential. So, when a sudden loss of consciousness occurs approximately 5 to 10 minutes after immunization, anaphylaxis should be considered as a possible diagnosis. But one should also consider fainting or vasovagal syncope as an alternate diagnosis. And it is important for us and for all health workers to remember the difference between anaphylaxis, a general stress response, and fainting. We request you to please click on that link below to access this manual, what you see on the screen, which is the Immunization Stress Responses, a manual for program managers. Let's look at the differences between a vasovagal syncope and anaphylaxis. At the onset, the vasovagal syncope occurs suddenly, sometimes before, sometimes at the time of vaccination, or immediately after injections. An anaphylaxis starts seconds to minutes after exposure, and almost all cases occur within 1 hour. When you look at the skin in a vasovagal syncope, it is usually pale, cold, sweaty, and clammy. Whereas the skin in anaphylaxis is seen to be red, it could be raised with itchy rash. There could be a swollen eyes and face, and there could sometimes be a generalized rash. When you look at the respiratory tract or the breathing, the vasovagal syncope person might manifest with normal or deep breaths. Sometimes there could be even rapid deep breathing. Whereas in anaphylaxis, there is very noisy breathing. There could be wheezing or stridor, which is actually difficulty in pushing the air outside. There could be persistent cough. When you look at the heart rate and the pulse, you will see that in vasovagal syncope, the pulse will be quite slow. There could be a temporary loss in blood pressure. Sometimes the pulse can even be normal or even rapid. Whereas if you look at anaphylaxis, the pulse is usually very rapid and the blood pressure is always down. Looking at the gastrointestinal symptoms, basically vasovagal syncope patients manifest as nausea and vomiting. Whereas in anaphylaxis, there could be abdominal cramps, vomiting, and nausea. When you look at the nervous symptoms, that in anaphylaxis, there could be a loss of consciousness not relieved by a supine position. Whereas when you look at a vasovagal syncope, the transient loss of consciousness is reversed by a supine position. But generally, remember, a person who is suffering from a vasovagal syncope is more agitated. There is a lot of fearfulness, dizziness, numbness, weakness, and tingling around the lips and spasm in the hands and feet. So once anaphylaxis is diagnosed, we need to treat it. So the drug for administration is adrenaline, which is the drug of choice. A 1 in 1,000 dilution adrenaline has to be administered. It has to be administered immediately as an intramuscular injection at the midpoint on the anterolateral aspect of the middle third of the thigh. In other words, it is in the outside of the thigh. It should be repeated every 5 to 15 minutes as needed until there is a resolution of the anaphylaxis. The presence of a persisting or worsening cough associated with pulmonary edema is an important sign of adrenaline overdose and toxicity, and this should be carefully looked for. The dose has to be administered according to age. Generally, for children, the dose is 0.01 milligram per kilogram, and for adults, it is 0.2 ml to a maximum of 0.5 ml. So let us quickly recap some of the key points which we have learned so far. The known safety profile of COVID-19 vaccines is similar to existing injectable vaccines. It is important to report all AEFI that are brought to your notice and ensure adequate medical intervention and referral as needed. Please fill the COVID-19 AEFI reporting form in a complete, accurate, and timely manner and forward it to your supervisor. Because COVID-19 vaccine is a new vaccine, it is essential to notify any safety concern and provide support during any of the investigations. Here are the resources and references which you can access online. Thank you very much for a very patient listening.